Hypnotic. Hello, my name is Karen. I'll be your student nurse today. Can I get you to confirm your name and date of birth, please? Newman J. Matias, 3/2/1973. Perfect. And your allergies? Sulfonidyne. All right. So it looks like you have an order to have an NG2 placed. Is that okay? All right, perfect. Just a few questions before we get started. Have you ever had an NG2 placed before? Okay. Do you have a history of a throat surgery? No. What about a nose surgery? No. Okay. What about a stomach surgery of any kind or abdominal surgery? Nope. Okay. So we're gonna go ahead and get started. I'm gonna place you at a good working position for me. Are you experiencing any nausea or vomiting? Okay. So I'm also going to place you in a high Fowler's position. All right, perfect. All right. Do you have difficulty swallowing? No, okay. If I wasn't sure about my patient's ability to swallow, I would go ahead and perform a bedside swallow test. Okay. I'm gonna shine a light to see your nose. Is that okay? So what I'm looking for is a deviated septum or a perforated septum. I don't see any. I'm gonna go ahead and test your nasal patency. So go ahead and breathe in while I cover one. Breathe in while I cover the other. Okay, so we're gonna go ahead and use that one since both are okay to use, but this one's the one closest to me. All right, I'm gonna go ahead and place this here. And place this here as well, just in case there's emesis. All right, and then I do have some water here for you. It is full, so I can go ahead and get started. I have everything I need. This is not a sterile procedure, but it is a clean one. Okay. I would have somebody else helping with me with the patient positioning, and also when it comes time to have the patient swallow water, they would help me out with that. Let me go ahead and open up my packaging. So what I'm going to do now is I'm going to measure the nasogastric tube from the tip of the nose to the ear, and also from the ear to the end of the xiphoid process. I'm going to move this out the way for a second. To the end of the xiphoid. There you go. So it is about 60. I'm going to add a few inches and we'll call it 63 just so I have a little bit more room. I have my tape ready. I'm going to tape that to ensure that is my stopping point. Place this back here. I'm going to coil it around my fingers just to make it a little bit more flexible. Okay. So I'm going to go ahead and put lube. A generous amount. So at this point, I would have my patient have his head tilted back. That way I can get past the gag reflex and make sure it is within the back of the throat. So it is hard to do that on the mannequin, but his head would be back as I'm inserting. So I would have the patient take deep, slow breaths as I'm going inside. Okay. Once I think I have past the gag reflex and I am in the back of the throat, I'm going to go ahead and make sure it is. At this point, I would have the patient move his head forward so his chin is to his chest. I would have my assistant make sure that the patient is drinking water. And then I'm gonna give my patient a second to relax. Once he is ready to continue, I have anything else that I might need. I'm gonna go ahead and insert 1 to 2 inches each time the patient is swallowing water. So the patient is swallowing water. I go ahead and insert. Swallowing water, I insert. Swallowing water, I insert. If I feel resistance, I'm gonna go ahead and move it a little bit, kind of twist it, but I don't wanna push too hard. But I keep going in. Each time the patient is swallowing. Okay, and I'm keeping note of where my end part is, which is right here, just to make sure I'm not going further. My section is already set up when the time is ready. There's a little bit of resistance with the mannequin. Push it out a little bit, kind of maneuver. There we go. Just need to move it a little bit more downward in a downward motion. So moving it around in a more downward motion is gonna move it a little bit more. So I have reached where my tape is. I'm gonna go ahead and get some tape to secure. Put it on his nose. I would make sure I clean it with some alcohol just to get rid of any oil and dirt. So I have it placed. All right. And then I'm gonna do some tape the opposite way just to secure it more. And then also tape it to his chin. Again, I am cleaning that area to ensure that the NG tube will stick. I can go ahead and make sure it is covered. And then I can get rid of this. The patient did not need it in this situation. And just some more tape. Okay. Since I want to make sure the patient has the NG tube in the correct place, I'm just going to secure it to his gown. I would do so with the safety pin, but I have tape with me at the moment, so he is good there. So the x-ray is just gonna show us that like I said, the NG tube is in the stomach. Once we have assured that it is in the correct placement, the patient would be back in his room. I would want to make sure his gastric contents is not too acidic. So what I would do is I would use a syringe. I would pull some gastric contents out. I can place it in this medicine cup. And then with my pH strips, I would use the testing strip, put it in the gastric contents and wait for it to match a color that goes on this scale. I want it to be acidic, so it has to be about 4 or 5 is what I'm looking for. And then once I'm ready to suction, I will make sure I have the correct orders to do so. I will have my suction ready and my little plug, that way it'll go blue to blue. And then I can connect the Zentube tube to the suction. And the setting is gonna be at low intermittent suction. I don't want it on continuous. And then as I'm watching the suction go, I wanna make note of how much is coming out and how many times it needs to be emptied. And then I also wanna assess my patient frequently for any nausea, vomiting, any pain, any discomfort. And I would also want to document everything as well. Once I have done that, that completes my assessment on the NG tube.